Shin splints is a condition that occurs when the muscles in the anterior or posterior portion of the lower leg swell, causing pain, swelling, and possible numbness in the affected area. Common causes of anterior compartment shin splints is usually due to a tight Achilles tendon, which causes the foot to slap down while running, resulting in an overuse of the anterior muscles of the legs. Once a person stops running, the pain will diminish, only to return once running is resumed. Posterior shin splints, generally, are a result of overuse of the posterior muscles. This is usually due to a condition known as pronation, where the feet flatten out too much during the gait cycle, resulting in overworking of the posterior muscles. Again, the pain will diminish if you stop running, only to return once you resume running. Diagnosis of shin splints is typically made through a physical exam, and taking a good medical history. Treatment for shin splints typically involves rest, ice, compression, and elevation, known as the Rice method. Icing the lower leg before and after a physical activity such as running can also be very helpful. Doing yoga may also help, as it will stretch and strengthen the muscles of the lower leg. It is important to make sure your athletic shoes are not worn out, as this can exacerbate the symptoms of shin splints. The gold standard for treating chronic shin splints is through the use of orthotics. For anterior shin splints, an orthotic should have an external heel lift to reduce the tension on the Achilles tendon. For the treatment of posterior shin splints, the orthotic should be made well enough to reduce pronation in the feet, which in turn will result in less overuse of the posterior leg muscles.